This is the ward at Leeds General Infirmary, where children are prepared for and recover from complex operations to mend their hearts. For a year, the surgical unit here has been scheduled for closure. There's been a huge campaign to try to prevent that. More than 600,000 people signed a petition, and a High Court judge ruled that parts of the process of selecting Leeds were unlawful. Now, the decision to close has been put on hold. Jack Rushworth had his first operation here as a baby and has just had his third. He and his mum say today's announcement only means more uncertainty.
It's not a decision, really. You know, it's just, again, it's a bit of a stalemate. But I hope now that Leeds can fight its corner.
I feel sorry for them people what haven't had their operation yet. Well, it could be shutting and they'll have to go a longer way.
To concentrate surgical expertise in fewer hospitals, the plan was to cut the 10 centres nationwide to 7. Leeds, Leicester and the Royal Brompton Hospital in London were to shut after an assessment called the Safe and Sustainable Review. Today, the Health Secretary announced that review's decisions are being scrapped.
The report also concludes that the outcome of the Safe and Sustainable Review was based on a flawed analysis of the impact of incomplete proposals and leaves too many questions about sustainability and implementation.
However, the Prime Minister emphasised the principle of cutting the number of specialist units still applies.
As the parent of a desperately ill child, wanting to get the best care for that child, you need to know that you're getting something that's world best for really technical operations. You can't have that everywhere.
Child heart surgery isn't the only specialist service in need of reform to raise standards, which is why campaigners for Leeds say lessons must be learnt from this.
There are some really difficult conversations and decisions to be made about healthcare, but the important thing is to do them properly, fairly, transparently, and with the patient right at the heart of it.
A new assessment process now begins, but it'll be another year before families of sick children will know if their heart surgery unit is closing. Catherine Jones, 5 News.